My name is Elizabeth. This is my first YouTube video, my first YouTube channel. I'd like to thank you for tuning in. We shall be talking about sensitization of various diseases that we have, common diseases and also uncommon diseases. We shall also be looking at the calendar, the health calendar, the days of the month, the months, and also the weeks health calendar. I shall be sensitizing you and also giving you updates on various diseases that you have. Today we shall be discussing gastro-esophageal reflux disease, GERD or GERD in short form, that is GERD, GERD, which this week is Gastro-esophageal reflux disease week, awareness week, which starts from today, 17th to 23rd of November. So we shall be discussing GERD or GERD in more broad, but also in a language that you can understand, a layman's language. Thank you. So what is gastro? I shall be diverting my eyes to my laptop so that I can be confirming some of the things, so that I can give you a clear information, 100% information. So thank you for tuning into my channel. Kindly subscribe and also like my video. I shall be posting every now and then, every week, if need be. Thank you. So what is GERD? GERD is a condition in which acid containing contents in your stomach persistently leak back up into your esophagus, the tube from your throat to your stomach. So what is the esophagus? It's the tube from your throat, from the throat here to the stomach, here. So from here to here, it is the leakage from the stomach contents which contain acid, that is hydrochloric acid, and also which reflux, which come back to the pipe, to the tube that connects the throat to the stomach. So it is a condition which acid containing contents in your stomach persistently leak back up into the esophagus. So which may cause heartburns. You know, heartburns, you feel like something is burning your chest and also your throat, and you can also have a bitter taste in your saliva. What is the main symptom of gastro-esophageal reflux disease? That is chronic acid reflux. What is the main symptom? The main symptom is heartburn and acid regurgitation. So you feel heartburns every now and then, which means that the acid content, the stomach content is leaking back to your esophagus, the esophagus. Sorry for the pronunciations. So it is very common. It's common in so many people. That is 20% of the population gets GERD. So the risk factors, that is, you are at a risk of getting, it is not necessarily that you get the disease, but risk factors of gastro-esophageal reflux disease is number one, overweight, being overweight or obese. Overweight means your height against your weight, which means you check your height and also your weight. When you calculate it, you will get a BMI. A normal BMI is from 18 to 24. 18 to 24. Above 24, that is 25 to 24.5 to 30, that is being overweight. then above 30 you are obese. So between above 24 going up, your BMI means that you are at a risk of getting gastro-esophageal reflux disease. So kindly please go get checked in your nearest facility. You get your BMI checked so that you can know if you are at a risk of getting GERD. If you are obese or overweight, kindly please check on your weight, because you cannot change your height, but you can change your weight. You can exercise, you can do exercises, you can also check on your diet, and this will help at least for you to prevent you from getting gastro-esophageal reflux disease by a small percentage. So we also have pregnancy. Pregnancy on its own can cause a lot of factors, which can include gastro-esophageal reflux disease. And this is due to the hormonal changes in the system that can bring about high increase in hydrochloric acid in the stomach. So at least after pregnancy, you are now not at a risk of getting GERD. Another one which poses a risk in most of the diseases are caused by smoking. Tobacco smoking causes most of the diseases, if not most, all. Tobacco smoking can pose a risk of getting GERD. Also taking certain medications like NSAIDs, non-steroidal anti-inflammatory drugs, that is some painkillers like diclofenac and brufen, which can lead you into getting high increase in acidity, which can bring the heartburns and also pose as a risk of getting gastro-esophageal reflux disease. So kindly please, if you are into taking painkillers, please note that you are not supposed to take a lot of non-steroidal anti-inflammatory diseases, drugs, which can note that if you are into taking painkillers every now and then, maybe you have chronic pain, like you have arthritis, and sometimes maybe you can be having frequent headaches, frequent backaches, kindly please try and look for better alternatives for the pain relief. Please do not get used to taking long-term use of non-steroidal anti-inflammatory drugs, which can give you high acidity, and also you can get silent ulcers. So kindly please refrain from that. Thank you. And if you are a smoker, please cease or stop. Cease from smoking tobacco. Tobacco smoking is harmful to your health, and it has zero advantages. Only disadvantages, zero advantages. It's the only thing that has zero advantages. Yes. I talked to someone the other day. I asked them, why do you smoke? Then he did not have a reason. It's because of the addiction. But I told him, for tobacco, it's the only thing that has zero advantages. He told me that there is one advantage, that it helps in the economy, increase economy. So when you sell, you get money circulating in the country. So that is the only advantage that it has, but in either way it does not have an advantage. So what causes GERD? What causes GERD is too much pressure in the abdomen, that is during pregnancy, and also for the obese, you have too much pressure in the abdomen. Also particular types of food, that is diet, spicy, dairy, fried foods can increase your acidity in the stomach. Medication, some medications which treat asthma, some medications which treat high blood pressure, allergies, painkillers as we had discussed earlier, also sedatives, hypnotics, and antidepressants can increase the acid in the stomach, which will lead to GERD. Also a hiatal hernia. A hernia is the abdominal contents, that's the intestines, move from the abdominal cavity into the abdominal wall, that is into the muscles. That is more advanced surgery, but it can also bring about the problem, that is a hiatal hernia. We have different types of hernia, but a hiatal hernia is what will cause gastro-esophageal reflux disease. So those are the causes, the main causes, but also it can also be a lifestyle disease. One, with the diet, number one. Number two, also spending more time sleeping on the couch, maybe watching the television while sleeping, eating while sleeping, and also eating. You need to take like 3 hours. When you eat, you need to take 3 hours before going to bed. So when you eat and then you go straight to bed, it can cause gastro-esophageal reflux disease. So it can also be a lifestyle disease. It is the diet, how you handle yourself, in the house, also the timing of your eating, and also inactivity, which can cause obesity. So what are the symptoms of GERD? We had discussed that the main symptom of GERD is heartburn, but we also have others. So number one, heartburn. Number two is regurgitation of food into your mouth and into your esophagus. So you will have food, you will feel that the food that you've just eaten has come back into the mouth or into the throat. You can also feel your throat has food caught up in your throat. So yes, that is just the reflux of the food that you've just eaten. Coughing, you can have persistent dry coughs. You can have chest pains. The chest pains can also radiate to the back, into the shoulders, and also under your diaphragm. Everyone knows where the diaphragm is. It's here to the diaphragm. So you can get pains in your chest, in your back, and also in your shoulders. You can get some pain, and that pain can worsen when breathing in. When you take a deep breath, you can feel the pain in your chest. You can feel like it's a heart attack. You can also feel pain inside your shoulders or your clavicle here, and also in your back. It can radiate to the back. Yes, so you can feel pain even in your scapula, thinking that maybe it's something to do with your scapula, but it's just the reflux of the acid, which burns and then brings symptoms in this area, which you can feel like it's maybe pneumonia or heart attack, or you have back issues, but it's just the reflux. When we treat, when we manage the reflux, the pain will go away. So you can also have a problem in swallowing. You can have pain, you can have difficulty in swallowing due to the burning of the acid. You can also have vomiting and a sore throat or hoarseness of the voice because of the burning of the throat and the voice box. You can also have constantly clearing of the voice. You can also feel like clearing of the voice every now and then. So if GERD goes untreated, long-term GERD, long-term persistent reflux in acid, long-term persistent reflux in acid can have complications, serious health problems, serious health implications. which are: number one, esophagitis. Esophagitis is just inflamed esophagus. You have an inflamed esophagus, which can cause ulcers in your esophagus and also in your stomach. You can also have a Barrett's esophagus. A Barrett's esophagus, it's a damaged esophagus, which can have a risk to cancer of the esophagus. And also, now if a Barrett's esophagus has a risk of cancer of the esophagus, then also cancer of the esophagus is a complication of a GERD. So long-term persistent hyperacidity, reflux of the acid, reflux of the abdominal contents can pose a risk of getting cancer of the esophagus, and also having strictures. Strictures are like scars, so which can give you difficulty in eating. So kindly please get checked, and also prevention is better than cure because of the economic constraints of treatment of diseases, various diseases, and also the emotional trauma that you can bring to yourself and also to your relatives. If you're not infected, you are affected. It's a two-way thing. So kindly please get checked. Treatment is just reduction of, number one, let's grade them, let's categorize them. We have pharmaceutical management and also non-pharmaceutical. So pharmaceutical management is reduction of the acid by use of some medications, that is PPIs, that is proton pump inhibitors, that is, for example, omeprazole and esomeprazole, rabeprazole. They can help to reduce the production of the acid in the stomach. We can also use antacids, which that's the gel or the tablets, which can help to neutralize the acid that is already produced in the system. So you can so non-pharmaceuticals, we can change our lifestyle. We can change the lifestyle that we have. You can do exercises to get a normal BMI. You can also check on your diet, change your diet. If it is affecting you, kindly please avoid whatever is causing the high acidity. You can also stop smoking. If you are into smoking tobacco, please kindly stop smoking tobacco at once, please. And then you can also try to look for various means or modes of treating your pain, in case you like to use painkillers. And if the drugs that you're using for the other conditions that I mentioned earlier, please go to your medical practitioner to check on your medication and to know what is causing the acidity, and to change your regime. So please kindly look into your health. Health is wealth, and you only have one life. YOLO, you live once, and then also you die once, and there is nothing as sure as death. So kindly please, I'm not threatening you in any way, but please, these simple things can become bad, can become worse. So please look into your health. Your health is what matters most. You having a good system, it what matters most. So please remember, gastro-esophageal reflux disease, it can just happen like a heartburn, but it can cause very bad implications. So thank you for watching. See you same time, same place. Maybe once a week I can be uploading a video, a vlog every once a week. That is maybe Wednesdays or Thursdays. I will know, because you know it's new. I've just started to do. Thank you very much. Please show me support by subscribing to my channel and also to liking my video. Thank you very much, and I love you, and keep safe with COVID. Put your mask on and wash or sanitize, keep distance, and get vaccinated. Thank you.